Hello, everybody, and welcome to this week's Birth and Baby Talk. It's been a while since I got to host. I have been working overnights, and noon is a rather early hour of the day to get up when you didn't sleep the night before. So I have been missing in action, but I am so excited to be back. For those of you who don't remember who I am, my name is Meaghan Grant. I am one of the owners of Toronto Family Doulas, Hamilton Family Doulas, and Family Doulas of Ottawa, and obviously one of the hosts of Birth and Baby Talk, although Leanne gets to be live more often than I do these days. And this week we have a special guest. This is a topic that is near and dear to my heart. As many of you who have been followers of Toronto Family Doulas for a long time now know, maternal mental health, parental mental health is a huge passion of mine. And I am a firm believer in therapy for all. And I do think that this is something that a lot of new parents in particular can benefit from, as well as expecting parents. That's something we don't talk a lot about in our sort of society. Postpartum depression has gotten a little more mainstream, a little less stigmatized, but nobody likes to talk about the fact that you might be sad during your pregnancy. And so that whole perinatal mental health realm is one that can be challenging to navigate, on top of sort of the worries of what will people think, will they take my kids away, all of those fears. It's a complicated system to navigate. You don't know who you're looking for, what kind of therapy you're looking for. Is it covered by OHIP? Is it covered by your extended health benefits? How do all of these things work together? And so this week we wanted to tackle all of that and tackle that big world of what do I do now? And so we have invited Cree Lambeck to join us this week. I'm going to let Cree introduce herself, but we are so excited to have you here and to tackle this huge topic because it's a big one.
Thank you so much, Meaghan, for that warm welcome. Beautifully said. And thanks to Leanne as well for inviting me and hosting me. I'm thrilled to be here with you folks to chat about this topic today on how to find a perinatal mental health therapist. Meaghan's absolutely correct. The system navigation piece can be daunting, stressful at times, overwhelming at times, but it certainly doesn't have to be. So I hope that I can be of some help today in just breaking down one of those barriers. We have some tools to share as well that simplifies, what I'm going to chat about into a bit of a flow chart. So please don't feel you have to take any notes or specifically remember anything. We'll have all of that in the notes. But such an important topic, as Meaghan said, and something that really we could talk a lot more about and probably need to. So just really pleased to be here with this community today, and certainly happy to answer any questions that you might have, Meaghan, or that your members might have.
Fantastic. So I know that as a doula, when I walk in and I'm talking to my client, whatever stage of sort of that perinatal period they are at, when they start to tell me things like, I'm not enjoying this, I think I made a mistake. And I'm not talking the first 2 weeks. Everybody in the first 2 weeks questions whether or not a baby was a good idea. Just so all of our viewers know that in that first 2 weeks, when you are navigating like crisis mode, everybody thinks that, including the doulas who have more training and support behind them. But I'm talking about, this bigger feeling of overwhelm and can't get ahead. A lot of parents describe feeling like they've lost themselves. And I'm sure that in a year where there is a lot of global stress happening and things that somebody might do to regain that part of themselves, go out with friends, join a knitting club, go out to a class, those things are really restricted right now. So it's even adding this added layer of isolation to a period that can already feel really stressful and overwhelming and isolating to begin with. So when someone sort of gets to that point and I say to them, I was like, listen, some anxiety is normal, some sadness and depression is normal, but when it starts to impact your ability to enjoy parenting, it's a problem. That's when we want to bring in some professional help. My client says, okay, I'm willing to try this. Now what?
Great question. Now what exactly? And your hypothetical client has reached a really important point in taking that first step. Whether it was help that they sought out or upon your recommendation, taking that first step is so hard and also so important. And so I guess the first step beyond that step, or even the second step, I would recommend is tell someone that you love and care about that this is your intention. Make sure somebody knows, someone that you care about, that you trust, that you're reasonably sure is going to give you a supportive and empathic response and be there for emotional support. Tell this person just a little bit about what you're experiencing and your intention to go ahead with this journey that you're on, right? So that can be an important step as well. Following that, I recommend checking two things. So you want to check with your family doctor to see if mental health services are available as part of the team of care that they provide. So not all patients are aware that some physicians are part of a family health team and some aren't. If you're fortunate in that your physician is part of a family health team, and we have a big one here in Hamilton, that means that all of the services that are available at that clinic and through the larger organization are open to you and available to you and all covered under OHIP as a patient there. So that's a really important piece. So see if they have a mental health counselor on their team. If they do, it's appropriate to ask about training and knowledge and skill base around perinatal mental health concerns specifically, because it is a specialized field. And we always want to make sure the support we're getting is perinatal informed in that way. So you have a right to ask those questions. If the answer, feels like a good fit, feels like they have the background that you're going to need, feels like this individual might be able to help and support your needs, see about setting up some regular appointments. So the downside of, primary care is that the wait times can be long. It's very busy and demanding, but see if you can set up some regular, consistent appointments, perhaps monthly or whatever they can manage, especially in that short term, to help you through those trimesters, and the postpartum period as well, right? So that fourth trimester is so important as well. Through the family doctor, you can also access the Women's Health Concerns Clinic. So that is another OHIP covered service available and run out of St. Joe's, but it does require a doctor's referral. So that would be another point of connection with your GP or family doctor. Okay.
And I'll just jump in there because we do have viewers who are sort of across the province.
Okay.
So for folks in Toronto, there is a program out of North York General. There is one out of Sunnybrook. There is a very well-known sort of joint program between Mount Sinai and Women's College. That is the program the vast majority of people are referred to. In Ottawa, there are hospital-run programs through there as well. All of them, just as this program in Hamilton and St. Joe's, are referral based. So you will need to get your family doctor, your GP, to provide that referral. And it can sometimes, again, access and barriers are a bit of a challenge here because Toronto especially is very patchworky. Sometimes even if you gave birth at a particular hospital, if your home address is outside of their catchment area, you get referred elsewhere. So sometimes it can take a few referrals. All of the programs do tend to have wait lists. I always recommend people get on the wait list. And if in 2 or 3 months when your name comes up, you don't need it anymore, you can totally pass on this and say, you know what? I was in a rough spot at the time. Things have evened out. Give that spot to the next person on the list. But it's better to be on the wait list now and have your name come up later than realize later you're now in crisis and now you still have another 2-month wait to go. And the wait lists are dependent on program, but in Toronto in particular, some of them are as much as 4 months. So it's one of those things I really encourage people to get on early.
Yes, absolutely. Great points. And wonderful to hear that your scope is so wide with all these surrounding communities. So again, as a first point of contact, checking in with the doctor and agreed about the wait list. You don't necessarily, you have the right to change your mind. You're in complete control of what happens with that referral, but giving your consent so that the practitioner can put through the referral can be an important step and speed things along. The second thing I would recommend checking is with any private insurance benefits. So check with your provider if your workplace does provide benefits or your spouse has benefits. What do those look like? And you want to really get specific in the questioning here. So what we're interested in is what is the designation? So mental health counselors fall under different designations, and this really, really matters to insurance companies. So is the practitioner that you want to work with a social worker? Are they a registered psychotherapist? Are they a registered psychologist? And there's a difference there in the wording between the psychologist and the psychotherapist. And again, the insurance company will care about that piece. So just check carefully. Also, what are the maximums or the ceilings on those benefits? What does that look like? So that'll give you a good sense of if there are some resources there to work with. Okay. If there are, a great directory of where to find a perinatal mental health therapist is the Postpartum Support International directory. So even if you simply Google Postpartum Support International, you can easily navigate through that directory. You type in your location. Again, it is international, and it will send you and generate a list of therapists in your area. You can be sure that the individuals on this list are vetted and trained in treating and assessing mental health, perinatal mood and anxiety disorders, and have specialized proper training in those areas. So that's another really good source of support. They also have tons of resources on their website, not just for birthing people, but partners as well and families. So lots of great resources that maybe you can grab while you're there. Okay. So those are a couple of options. Now, what happens if my family doctor doesn't have a mental health counselor or isn't part of a family health team, and I don't have any kind of private insurance benefits? What happens then? So let's talk about that, because that's obviously really important and a big barrier that does exist. We are somewhat fortunate that right now, because of the pandemic, in some ways, accessibility is better than it ever has been in terms of accessing mental health services. Certain programs that are generally pay for service have been opened up and are being offered for free right now. There's a wonderful resource called the Affordable Therapy Network, where again, you can put in your location and it will generate low-cost sliding scale subsidized programs that may be available for you. There are some free online CBT programs right now. Ability and Mind Beacon are two that are quite well known. Now, these won't be perinatal specialized, but they may be helpful for some areas of your life or some concerns based on what you're experiencing and what your needs are. There's a telephone coaching program that's also covered under OHIP called Bounce Back, and that's been helpful for some folks as well. And just one other quick one, Meaghan, is joining a pregnancy or postpartum group. So there's some wonderful ones, all over, lots in the Hamilton area, certainly. And this is a great place to find support, solidarity, other people who are experiencing similar concerns and are, pregnant or giving birth during this pandemic.
For sure. I apologize for keep jumping in on you there.
Okay.
Two things I want to mention, for those of you who are on your maternity leaves, some employers also have an EAP program, an employee assistance program. These sometimes have access to a limited number of sessions with a therapist. In addition to that, I just wanted to jump in and get you to clarify, just because I know that some of our viewers are really new to this idea of therapy. And you mentioned CBT, and this is something that people are going to run across a whole bunch if they start going down this path. But let's just clarify, because when people think therapy, let's be honest, they all think of like the couch and the recliner and the like old guy in the corner with his pad and paper. And we think of that sort of very traditional, almost Freudian sort of talk therapy. And there are a lot more options than that these days. It's not just, and how did you feel when your mom did that? It's a lot more, oh, there's the alarm telling me to send my kids back to school. Parenting at home during a pandemic is a whole trip. But so CBT is sort of one of the really big I'll say therapy approaches that I've seen, especially over sort of the last 5 to 10 years. So can you sort of clarify just a little bit what CBT is versus that traditional talk therapy so people know what they're looking for with those programs?
Absolutely. And thanks. That's a great point. So CBT stands for cognitive behavior therapy. And you're right. It's a very universal approach. It's an evidence-based approach. It's really considered a gold standard right now in especially the medical practices, and used by a lot of physicians and mental health counselors on those teams as well. Some therapists do specialize in CBT therapy. That's sort of what they have most of their training in and their niche that they practice. And other therapists bring elements of CBT into their practice and blend them with other modalities and therapeutic approaches as well, for more of an integrative approach. So CBT essentially looks at the relationship between our thoughts, our feelings, and our behaviors. So it helps us to understand some of those thoughts that might be swirling, through our heads, some of those thoughts that might sometimes hijack our day or our plans, and create some obstacles and barriers. And we look at the emotions that come out of those thoughts. So what emotions are activated in me as a result of some of these things that I'm thinking, or some of the thinking traps or patterns that I'm getting stuck in. And then as a result of those feelings, what do I do? So what do my behaviors look like? What do I notice myself doing? Am I feeling irritable? Am I snapping at people? Am I crying a lot? Am I retreating or withdrawing or socially isolating myself more than we already are? So what do I notice myself doing, and how do the thoughts play back in? So it's very much a cycle where we explore the thoughts, the emotions, and the behaviors, all as part of this really impactful cycle on our system. There's lots of other therapeutic approaches as well. And not everyone practices CBT, but that's one that you might come across the acronym because it is well known.
And with CBT, one of the goals of sort of examining that cycle is really about figuring out ways to either interrupt or change that cycle and that pattern in order to sort of move past those stumbling blocks. Is that sort of right?
Yeah, so we learn how to recognize those emotions and behaviors that show up. And we also learn to connect those back to our thoughts, right? So our thoughts are very, very powerful. And some of our thoughts, we might be really aware of what those thoughts are. Other thoughts can sort of sit under the radar, or in a busy day can sort of get shoved to the back. But those thoughts can be activating and triggering. Just think of a time where you thought of a sad memory and you had tears come to your eyes. Those tears, right? That physical sort of concrete thing that you can see in those tears came from your thoughts, right? So our thoughts are really, really powerful. And we do some work at exploring and looking and unpacking what some of those thoughts are. And for those thoughts that are particularly unhelpful or getting in our way or kind of hijacking our system, how can we work with those thoughts and learn to adjust and manage and support ourselves in softening the ones that are really unhelpful and kind of barging in with thoughts that put us in a better place and give us a better sense of well-being.
And that bit you said right at the end of sort of softening those hard thoughts is, I can just, as a doula, I can think of all of those times that parents are saying, I'm not good enough, all of those thoughts that come along with, especially breastfeeding didn't work, this didn't happen, that didn't happen, all of those thoughts and fears that as new parents we have, I can imagine for all of us that being able to soften those is a huge skill. And, as doulas, we talk a lot about having grace and patience with ourselves and sort of giving ourselves that time and space. And this is a lot of what this is about as well.
Beautifully said. Beautifully said. Absolutely. That's so key. We live in a scarcity sort of culture. There's a scarcity epidemic, another epidemic, but it's not enough, right? And even to the feeling of I wake up and sometimes my first thought is, oh, I didn't get enough sleep. Or will I have enough time today, right, to do everything I need to do on my list? There's sort of this constant scarcity around having enough and being enough and all of the things lining up in this way. And we also, in our practice, we talk with a lot of women and moms around the mommy myths, right? We're also living in this age of anxiety and sort of do everything, be a super mom, manage it all, never drop a ball, never let anything slip. And it's, of course, we know those standards are unrealistic. Absolutely.
The mom over here is like, yeah, the balls are dropped.
Yeah, good, right?
As long as you don't slip on them afterwards, it's all good.
I love that. I love that image. That's a good one. But that's it, right? And I think we need to also continue to acknowledge we are living in a pandemic. The longer it drags on, the easier it is to minimize the impact of that, right? But there's a tremendous amount going on. There's constant acute stressors that are coming in, and to have some support and some coaching and guidance, someone to sort of walk alongside us during a time when we're struggling or in pain, can feel good.
I always say it's the neutral third party. It's sometimes, and as a doula, that's often the role we play. And as a therapist, I'm sure that's often the role you play, is there's that person in the room that doesn't have an opinion on how you do it or what you do or what you think, is incredibly powerful, because everyone else is telling you what to do, what to think, what to eat, how to deal with your baby, all of it. We are often the people that aren't. And there's power in that position, but there's also, it's about giving that power back to the person in front of us, because they get to just be in that space.
Absolutely. That's such a good point. Sometimes we talk with family and friends and we can get lots of emotional support or practical support that can feel good and meet our needs to a certain extent. And a lot of women tell me, who come to therapy, I didn't want to feel I had to protect anyone. I didn't want to feel I had to hold back. I didn't want to feel, after someone had held the space for me, I didn't want to feel that guilt that sometimes comes up, or did I share too much, or that vulnerability hangover we can get, right? That burden. People, especially now, we're all struggling, everyone's just in survival mode. And so we all have stuff that we're dealing with. And so people come to therapy largely because they're looking for that safe therapeutic space where they can say anything, explore anything, wonder away, and there's someone there to hold the space and to walk this path with them.
For sure. So people now hopefully have sort of an understanding. And as you said, there's lots of different sort of therapeutic modalities and ways to approach sort of the actual therapy itself. So now people have sort of in these sources you've looked at that you've recommended. And again, we're going to drop all of this in the comments for everybody. You don't have to be frantically scrolling back and listening. But Postpartum Support International is one of them. And so people have they've now got this list of the people close to them. All of them have perinatal mental health. It's still probably a pretty big list. And if the first couple of names you call on that list say, sorry, we're not accepting new patients right now, it can be really hard to keep calling. Yeah. Especially when you're already in that sort of darker place, and it can feel really hard to feel motivated. So what is the best, is there a best way to approach that list of names? Is there a better way of accessing that sort of help from that point?
Yeah, great question, Meaghan. So if we go back to step one of telling somebody, sharing with somebody, this is your intention, you're going to do some system navigation here. Can that person be a support to you? If things get overwhelming, if there's barrier after barrier, can this person help you and troubleshoot with that system navigation piece can be important. But also, how to narrow down that list, right? So most therapists, private therapists, or many private therapists will offer a complimentary consultation, 15 or 20 minutes, to sort of ask about fit. Feel free to ask about training or credentials, ask any questions, bring any questions that you have to that consultation. That's for you, and there's no strings attached. If the feedback via the consultation or perhaps an email inquiry is, unfortunately, we're full, see if that therapist can recommend somebody else. Hopefully they're doing that anyway, right? But always nice to get another name, another personal recommendation and referral, and lots lots of times we know who else has space because we work closely together. Lots of wonderful therapists and colleagues doing this work, and we stay pretty closely connected through our network. So hopefully we'll have another name and resource to offer.
That's good to hear. Sometimes it's hard.
It can be really hard, and and we're doing this, right? We're likely navigating this complex system at a time when we're not feeling necessarily strong. We're not necessarily feeling organized and like we have, all our ducks in a row. So we're doing this again in a time of great stress, vulnerability. It can be really, really hard. And again, that's why it's so important to take this step, but also to build the support team around you. So we talk a lot with women about building that team. Who is on that team? That circle of support may consist of your healthcare professionals, family, friends, right? So who provides the emotional support as well as the practical supports and those professional and community supports as well. So if we the idea that if we build this really strong and tight sort of wraparound support circle, that circle of people who care about us and who have skill and training in this area can help us through, right?
For sure. Wonderful. Now I want to jump in just because, I know that a lot of our viewers, depending on where you are, come from sort of very specific groups. And I'll say that for those individuals, LGBTQ families, BIPOC families, any of these groups, sometimes the best place to find the right therapist for you is actually in these social media mom groups, that sort of thing, because they will have a really good understanding of who has specialties in both sort of the I'll say marginalized identity and also the perinatal mental health aspect. So that's probably going to be honestly your best and fastest place for those groups. For those of you who are looking, also I've done that search. I've done the Psychology Today where you have like walls of names. They will often list their additional specialties if they have specializations in those areas. So that's a really good place for people to start if you are nervous about sort of just cold calling, particularly if you come from a background or place of sort of difficulty navigating the system or additional difficulties in navigating the system.
Mm-hmm. Mm-hmm. Those are great points. And even starting with, as you mentioned, some of those social media groups, there's some really wonderful, powerful groups and communities and networks out there like this one. But starting there, and then if some individual names are shared, then go punch those into Psychology Today. It is a nice directory in the sense that, as you mentioned, Meaghan, it gives the history, a bit of a profile, usually a picture, so we can get a little bit of a sense before we even speak to one another in the consult, but you can sort of then have at least some names to plug in and see what you get and how that feels.
Wonderful. Well, thank you so much for joining us, Cree. I think what we're going to do for everybody, we're going to drop all of those resources that we've sort of talked about today in the comments. It might take us a few hours, give us a little bit of time. And as always, the replay of this will continue to live on our Facebook. It will also be uploaded to our YouTube channel. And if you are not signed up for our newsletter, you need to be signed up for our newsletter. In addition to replays and resources, this is also a place where we share special deals that only our newsletter followers have access to, as well as some other fun tips and tricks and doula hacks and information about my favorite Brussels sprouts recipe, which was last week, and whatever else is we toss in there. So this is just a place for everybody to sort of gather information and some great deals. So we will also drop the link to that in the comments. And as always, everybody, if you have questions or there's a topic that you want to see us address, feel free to send us a DM. If you want to see Cree come back and talk about something specific, send us a DM about that too. I'm sure we can have Cree back to talk about some very specific things if there are questions people have. And if you are a professional in our community and you would like to be featured on our show and talk about your specialty and your aspect, please also reach out to us. We are always looking for guests, and we are always looking to bring more information and new opportunities and services to our clients and community. Thank you, everybody, for joining us. It's been a fabulous Wednesday. And if you are in Toronto, drive safe on those roads. They're getting kind of icy. I don't know what Hamilton looks like today, but Ottawa is just as yucky. So everybody drive safe and keep safe this week. Take care.